to do the best of my ability during these extremely trying times in our town.
Thank you, Member for Araloon. Member for Blain.
Thank you very much, Mr Deputy Speaker. 1 in 5 fellow Australians will grapple with a dangerous addiction in their lifetime. It may be pharmaceuticals, illicit substances, alcohol or gambling, to name a few. An estimated 500,000 cannot access the health care they need because services are overwhelmed, inaccessible, unaffordable, or the waiting lists are simply too long. And I get it. In 2014, I was outside of Katherine in a bushfire with a domestic violence offender. He didn't want to be held accountable for his actions and attempted to flee as I attempted to arrest him. I got him, the handcuffs went on, and then the tendon that controlled my left hand snapped. This started a trip to hell and back through surgery after surgery to replace tendons in my hand so I could pass a grip test and return to duty. However, the nerves in my arm were and are frazzled to this day. I remain on a cocktail of medication to deal with it, and thank God the new stuff works reasonably well. But before I got there, I got on opiates, and I didn't do well. It was legal, it was prescription. I was a police officer, and it was through medical professionals and workers' comp, but my day revolved around my box of pills. To get out of bed, my wife would wake me up at 5 a.m, and I'd swallow my first pill for the day. It was early enough that the slow release would kick in to wake me up for work. I carried a little red bag of pills everywhere I went. It came out with me if I was called out at 3 a.m. to a negotiation job, if I was called out to fly to the islands or remote community, or was sent interstate to participate in the counter-terrorism exercises. And after I attended the incident where I won the National Police Bravery Award, my little red bag was still there in my car, keeping me company. And when I got home, a large glass of whiskey to take the edge off. There wasn't anywhere I had to turn, and it wasn't until I got in with a very particular health professional who knows who they are that they helped lift me out the spiral of pain and opiates. My very, very patient and forgiving family stood by me and picked me up whenever I fell and continued to do so. But there was nothing to help, and I knew I wasn't the only one. I was having issues being addicted to legally prescription painkillers with no stigma in going to the doctor to ask for help. And every fibre of your body hurts when you don't get your opiates. The chemicals in your brain struggle to recalibrate. I was lucky. My wife's a nurse. We've had our difficulties, been together for nearly 20 years, and without her I would probably be at the bottom of a bottle. But I'm not aware of an inpatient unit in the Northern Territory that doesn't have a long rehabilitation treatment time. Massive waiting list, or if you go private, still further waiting lists, and then the expense for the average person. Therefore, it's inevitably forcing people to choose between retaining their employment, mortgaging their house, taking out loans, applying to withdraw superannuation on compassionate grounds, and that's only if they can get a shot at getting the help that they need. This is on top of them then needing adequate leave to attend long periods of treatment, or the funds and the support of their employer to seek early assistance. Otherwise, they're condemned to a public waiting list at crisis point, feeling sicker, worse off, and eventually unemployed. Now, studies show that for every $1 spent on treatment services, our communities save 7. And for every $1 spent on harm reduction measures, our communities save 17. There's no other chronic health condition where we allow our inaction to cost our country over $55 billion annually due to impacts on healthcare, crime, productivity and road crashes. Addiction is still one of the significant contributors to the burden of disease, especially in the Territory. And dangerous addiction is a leading preventable cause of injury, chronic illness and death. Yet fewer than 1/4 of people who need help ask for it. And alarmingly, on average, it takes an Australian 20 years to seek assistance. It's due to shame, it's due to stigma, and this is due to fear, and I can certainly attest to that. But bizarrely enough, when people can't access help due to the lack of education, lack of funding or resources, we seem to fall back on incarceration, shame and shun them. In 2019, there were 134,000 people arrested for drug use and only 14,000 people arrested for supply. Australia's got one of the most expensive incarceration rates globally, and former police commissioners such as Mr Mick Palmer, APMAO, a former Territory Commissioner of Police, are publicly advocating for a dramatic shift in how we assist those grappling with addiction. It's not a matter of crime, it's a matter of health. And I can tell you shocking statistics after shocking statistics, and I can tell you many anecdotal stories I've dealt with personally as a police officer, but these numbers only mean something if we lead the way in changing the narrative. The politicised war on drugs is an abject failure. It's caused more harm to families, communities, workplaces and friends. It's harming our alcohol and other drugs, mental health and community care workforces. Our emergency services are overwhelmed, burnt out and unable to cope with the spike in demand and themselves falling foul of these issues, whether it's, again, prescription medication, alcohol or other substances to deal with the trauma or injuries, much as I did. The 500,000 Australians each year unable to access treatment should not be seen as numbers on a spreadsheet. Each one should be seen as a story of hope, of possibility, and most importantly, a human being who needs our help. I acknowledge that this burden cannot sit solely on the shoulders of the health portfolios. Fixing this will require nationally consistent approaches that can still respond to community needs. We need innovative, out-the-box answers to complex issues, and it's why I'm calling on the Northern Territory Government to investigate a proposal being put forward by the Victorian trade union movement. It's done in partnership with public rehabilitation providers, and it's called The Crossing. Modelled on the successful Foundation House model in New South Wales, which is funded by the CFMEU, ETU, HSU and CPSU, The Crossing will hopefully be Victoria's first worker-led rehabilitation outpatient and outreach service, providing healthcare for workers by workers to ensure that you do not have to lose your job to access healthcare. Employers and trade unions are currently not qualified to navigate the overwhelmed public and private systems when a family member requires urgent assistance with a mental health, alcohol, drug or gambling disorder. Through multiple first-hand accounts from trade unions and employers from all sectors, by the time a union or employer has been made aware of the severity of a disorder, usually because of disciplinary action associated with poor performance or attendance, or worse yet, being impaired on the job, the member's health is in such disrepair and their employment relationship has been so severely impacted that the employer usually has no choice but to terminate the employee, even if they don't want to, and sometimes at the demand of fellow employees. The Crossing proposal, which has been proven through the delivery of the thriving New South Wales union-initiated and funded Foundation House model, offers a free service that has a 28-day inpatient program, together with extensive and ongoing outpatient and outreach support for working people and their families, coupled with an education component on-the-job training for workers, employers and unions ensure that they can retain their employment or employees. The service would have the capacity to run daily toolbox talks across workplaces, implement sector-wide mental health and addiction health and safety representatives, and envision that employers would actively seek out the service. If we were to follow suit, and ideally hope we do, this service would complement and sit within the suite of existing services in the Territory and would take much needed pressure off our current struggling sector. Foundation House has been in operation for 20 years. It's not new. It's entirely funded via enterprise bargaining agreement clauses, direct donations by trade unions and in-kind contributions from corporate Australia, including industry superannuation funds. It's the view of our comrades in Victoria that the Crossing will operate similarly when it opens. Now, all states and territories, particularly with the exploding waiting list, must explore these solutions to complex issues such as mental health and addiction. I'm aware that currently the Victorian trade union movement has up to 30 unions on board, including retail, hospitality, emergency services, health, community services, manufacturing, transport, entertainment and many more. The initiative has the support of many superannuation funds as well as Odyssey House, Windana, Turning Point, the Victorian Alcohol and Drug Association, Harm Reduction Australia, Harm Reduction Victoria, Hope Street, Maurice Blackburn, Slater and Gordon, the Australian Council of Trade Unions and many industry leaders, including Mick Palmer, Jeff Gallop, Dr Alex Wodak, Professor David Caldecott and Fiona McLeod, to name a few. As former Foundation House graduate Dennis says, it's up to industry and it's up to the community to look after each other, and that's what we have to do. And if anyone's thinking about it, don't think about it, do it. Get the money together, set it up and do it. We've saved people's lives and we've saved people's jobs. The more you muck about, the less opportunity you have to save people. It's time that our movement put forward compassionate and financially responsible models of care for those who are grappling with addiction, especially for working people. As a government, we need to give people every tool available to seek assistance and get the help they need without losing their job or becoming sicker for longer. They need access to free treatment. Now, I'm supporting this endeavour wholeheartedly and call on the government and the Northern Territory trade union movement to come together to initiate a trial for the working people of the Territory. This is an excellent opportunity to save careers, save comrades, save families, friends, mothers, daughters, fathers and sons, and most importantly, to save lives. Thank you very much, Mr Deputy Speaker.
Thank you, Member for Blain.